It needs to be a standard mode of operation to incorporate social workers into patrol units that are responding to calls where there's a person with possible mental illness having a psychotic episode or other mental health crisis. Domestic violence, the same thing. All these situations where there's the possibility of mental illness being involved, where they've got somebody behaving very erratically, rather than drawing their guns, the standard solution needs to be for them to have a tranquilizer gun, a weapon that basically what it does is it administers medication that would normally be injected through an ampule, and when it hits the person, within a few moments, it brings them down. They don't fall and hit their head. I mean, people are able to get close to them about the time the medication kicks in, but they need to have something that non-violently sedates these people, because most of the time these people are needing medical treatment. They're needing medication, and they're not getting it because of our broken mental health care system here in the United States. The medical system is totally based off of profit, and they can't get access to health care because a lot of the time they're poverty stricken or homeless, or nobody really cares about what their needs are because there's not adequate mental health resources in the community. But a tranquilizer uh, dart or something to that effect would be much more intelligent and affordable as well, because you have to think too about legal. It's much more practical for these departments to pay for this tranquilizer dart system and tranquilizer guns than to uh, have to retain an attorney for liability in cases like that. And that's usually what happens. Usually the family ends up suing them, and they win a class action lawsuit in the millions or tens of millions of dollars because the person is killed when they should have been sedated or subdued non-violently. I know some people will say, oh, the guy was swinging a knife, or he had a bat or some other weapon. You don't let them hurt somebody else. I mean, you have to do something, and you have to do something, but that's what you have, the rubber bullets for, and beanbag rounds, but especially the tranquilizer guns. They need to have a standard method of delivery for these people. I mean, it's not hard to determine a safe dosage to use either. If you've got a 300-pound guy and each dart is designed to be used on a person who weighs 100 pounds, you shoot them with 3 darts and they're going to drop, unless they're, pumped up on PCP or something. But that's why you have to have social workers there. You have to have somebody there who can address the situation and diffuse it. And most of the time when law enforcement responds to a situation where there's violence potentially going on or might occur, the force continuum, it escalates things rather than de-escalating. And when they have a person who's brandishing a weapon, usually it's going to escalate almost 100% of the time, rather than being de-escalated by the safe use of some kind of pharmaceutical that you can administer from a distance against the person who's, a lot of the time they're behaving like, almost like a rabid dog. I hate to put it that way, but these people, when they get really out there, sometimes it's mental illness, a lot of the time it's substance abuse that makes them behave erratically. They're in withdrawal. It makes them crazy. But there are better solutions than gunning someone down when you're responding to a disturbance call like that. Shooting somebody should be a last resort. That should be the last thing they do. The gun should be, at the very back of their list of options.